بسم الله الرحمن الرحيم. أنا النهاردة هتكلم بس يعني short talk or small mini lecture on the difference between the psyche and the mind. إيه الفرق بين النفس والعقل؟ لأن كتير من الناس يلتبس عليهم الأمر، هل في ما هو تعريف النفس وما هو تعريف العقل وما الفرق بين الأمراض النفسية والأمراض العقلية. This is important. That's why I wanted to talk about this issue today. أولا السايكي والمايند, the distinction between them is rather vague. يعني مختلف عليه التعريف بالضبط ما هو النفس وما هو العقل والفرق بينهم ايه، لكن يعني انا احاول ابسطها لكم بقدر الامكان. السايكي هي من وجهة نظري المتواضعة ان السايكي هي السميشن او المجموع التوتال اوف the elements of the mind, both the conscious and the unconscious. بتشمل العقل والإدراك والعواطف والإحساس دي كلها وتأثير الروح على العقل. يعني actually نقدر نقول إن السايكي هي ال summation of both the soul and the mind together, or it is the result of the interaction between the mind and soul. That's why في بعض definitions يقال ان السايكي هي السول, the mind or the spirits. وده برضو كلام مش فيج، لانه ما اي واحده فيهم عشان يبقى يعني الاعتراض، وبالتالي لازم يبقى في عندنا تعريف واضح, well defined, sharp definition of what is the psyche and what is the exact difference between, and what are the limitations between the definition of the psyche and the definition of the mind. لكن in my point of view, the mind is the mind with all its contents, mainly the awareness or the consciousness and the thinking process, the aware thinking, the rational thinking, the conscious thinking, the critical thinking, the having a rationale. This is the mind, of course, in addition to the emotions, feelings, and the decision making and language and these things. But this is the mind. But the psyche is more generalized than just the mind. The psyche includes both the soul and the mind and their interaction together. It is the interaction of the soul with the mind, because as I mentioned before, for example, the human being as a creature is composed of three components: the soul, the mind, and the physique or the human body. The interaction between the soul and the mind and the effect of the soul on the mind, this is the psyche. And sometimes in colloquial terminology or colloquial usage, they use it to express the emotional life of the person. For example, when we say that this accident or this trauma affected this person's emotions and this person's life, هي تأثير الأحداث على الحالة العاطفية والحالة الوجدانية للشخص. هو ده يعني ما في الغالب يطلق على كلمة النفس. لكن هي زي ما أرجع برضو عشان الأمور ما تبقاش هلامية وغير واضحة، عشان تبقى واضحة الأمور أكتر، هي العلاقة بين الروح والعقل. إذن السايكي أعم وأكثر شمولية من العقل. السايكي هي تفاعل الروح مع العقل، تأثير الروح على العقل. It is the interaction between the soul and the mind, or it is the summation of the soul and mind together. But the mind, as I mentioned, is the mind with its definition and the components and levels and functions, which I talked about before. This is the first point in my talk about the difference between the mind and the psyche. Then we come to an important point, which is what is the difference between also the neurosis and the psychosis. The neurosis and psychosis, sometimes they talk and they refer to the psychological. This is the same as the difference between, it is the same, talking about the difference between psychological problems and mental problems, psychological disorders and mental disorders, neurosis and psychosis. What is the difference between neurosis and psychosis? Some authorities put the neurosis and psychosis together as two types of mental disorders, and some other authorities separate them. The neuroses are psychological disorders rather than mental disorders. And when we say mental disorders, we mean the psychotic problems or the psychoses, whether the functional psychoses or the organic psychotic problems. Let's talk about what is the difference between the psychological disorders. They are more minor, they are more a wide spectrum. It is when we say psychological problem, we mean any disorder affecting the psyche of the person, that's affecting his soul, affecting his mind, and so the summation of the both the spiritual affection and the mental affection together will be what we call psychological disorder, and this is usually referring to the neuroses. And when we say mental disorders, we mean the psychotic problems or the psychoses. Functional, again, like the schizophrenic disorders or affective disorders or schizoaffective or other types of psychotic problems. Functional or organic psychoses, as happens in patients with chronic brain failure in the dementia cases, or acute brain failure or acute organic psychosis, and this is what happens in the delirium tremens or in the acute confusional state. So there is an acute organic brain failure and chronic organic brain failure. Chronic organic is dementia with all its types and subtypes, and the acute organic psychosis is the acute confusional state, which I talked about it before, which sometimes we call it the delirium. The person is in a delirious state. Then this is generally the psychosis. The neuroses, as I mentioned before, the main differences is that the neurotic problems or the neuroses, they are characterized by physical and mental disturbances, minor mental disturbances, but and they are minor in nature. But the psychoses, they are major in nature and denote a major affection of the mind, and they affect primarily the personality and the behavior. They affect the personality and the behavior. The neurotic problems, they never affect the personality, and they never have a major behavioral problem, in contrast with the psychosis, in which there is affection of the personality and major affection of the behavior of the person. Also, there are major problems related to thinking in patients with psychosis, like hallucinations, delusions, and illusions. They characterize also the psychosis. But in neuroses, we don't have illusions, delusions, or hallucinations. We have other symptoms of psychological symptoms. So here there is affection of personality, there is hallucinations, delusions, illusions, there is a behavioral problem, there is major disturbance of the quality of life of the person and the people around him, and affection of his communication and affection of his language also, and major affection of his memory. So the language, the memory, the communication, the decision making, the will are drastically affected in patients with psychotic problems or psychosis, but they are not present in patients with neurosis. In neurosis, the most common neurosis, like anxiety neurosis, like depressive neurosis, like impulsive neurosis, like obsessive compulsive neurosis, like phobic neurosis, like hysteria. These are all neurotic conditions. There is disturbances, yes. There is disturbances, minor mental disturbances, in the thinking, sometimes in the affect or in the emotions, in the emotional reaction, in the there is planted affect, or there is agitation, or there is irritation, or there is a gloomy outlook, as in depression, negative thoughts, sometimes in depression also, agitation, irritability, inability to sleep, disturbance of appetite, physical symptoms like somatization in patients with anxiety, neurosis. So there are minor mental manifestations or symptoms with physical disturbances in the neuroses, but there is no what characterizes it, that there is no affection of the personality, no affection, major affection on the quality of life of the person, and there is no affection on the language comprehension, no affection on memory to a greater extent, and no affection on the thinking and the thought content and the rationale or rational thinking, or the ability to make decisions, or the ability to plan or organize, or attention orientation, or the quality, general quality of life of the patient. This is not present in the neurosis. But if the neurosis, which I mentioned, like anxiety, like depressive neurosis, like obsessive compulsive, like phobias, like if they persist for a long time and they are not treated properly, they might convert from being neurotic to the other end of the spectrum, which is psychotic problem. It becomes psychotic problem. So that's why the neurotic problems as a psychological disorders, they are rather minor in comparison with the major disorders of psychosis or psychotic disorders, which are psychotic disorders like the manic depressive psychosis, which is affective disorders, which affect mainly the affect of the person, the emotions of the person, like the major depression, or the mania, or the combination, the manic depressive disorders, or on the other hand the schizophrenic disorders, or the combination of both together, the overlap, mixed form, which we call it schizoaffective. There is an element of schizophrenia with element of affection of the affect, because in schizophrenia the main problem is affection of behavior, thinking. There's a disturbance of the thinking contents. That's why we find that the patient gets illusions, gets delusions, gets hallucinations, which are not which are primary in schizo, but in affective, no, they might be secondary in schizo. In affective disorders, the major problem is affect, as its name denotes. affect means emotion, مزاج. هنا تغير شديد في المزاج. لكن the changes in the affect is more severe and more drastic, and has implications and has its repercussions on the behavior in the exogenous or in the major depression, rather than in comparison with what happens in minor depression or exogenous depression, which happens in, because the also an important fact is that the neurotic disorders usually arise from or psychological disorders usually arise from external factors, exogenous factors, stress, anxiety, disturbed relations. So there are problems coming from the outside world which affect the mind and the soul, but many of the on the other hand, many of the psychotic disorders or psychoses, they are more intrinsic. They come from inside the body, from inside the brain, from inside the mentum, due to chemical changes, due to neurotransmitter changes. So this is the intrinsic theory of psychotic disorders, rather than the extrinsic, being extrinsic, which characterize mostly or mainly most of the neurotic disorders. So what are the causes? Is it intrinsic causes or extrinsic, endogenous or exogenous? So psychosis and mental disorders is rather endogenous. In most of the cases, the neuroses, they are rather exogenous due to extrinsic factors affecting the patient in his surroundings, in his environment, in his the world around him, which consequently affect his mood and affect his emotions and produces the neurotic symptoms. So this is what we call the extrinsic versus intrinsic factors in the causation of or in the pathogenesis of neurotic disorders versus psychotic disorders. This is the most important points which I wanted to focus on, the differences between the psyche and the mind, and the difference between the psychological disorders and mental disorders, and in abbreviation, the differences between neurotic disease and psychotic disease. And I give the general explanation of both. And of course, there are details about the different types and subtypes in each of these two major classes of psychomental disorders, and in the as regards the etiology, as regards the psychopathology, as regards the psychopharmacology of these diseases of the psyche and the mind. By this, I will end my mini lecture today, and tomorrow I will speak about the another issue, which is the chemistry of thinking and how it is affected in different disorders, biologic, physical, and mental disorders. Thank you so much.